Hey guys, so we're excited to tell you about this great project and the impacts that it's had across our entire system. But first, I think it's important to kind of set the stage and give you a little background about our community and what it entails. So we're located in the Eagle River Valley. Most people will know that as the Vail area. We span an area of about 50 miles along the I-70 corridor. Our hospital is a community and destination health system. The destination piece of it is high-end cancer, cardiology, primary care, but with a huge focus on orthopedics. Since we have two large international ski resorts in our backyard, we do drive a lot of orthopedic cases here. And our hospital is a non-for-profit hospital with 56 beds. Next slide. The Eagle River Valley, as I mentioned, spans 50 miles, and it starts in the mountains in Vail, Colorado, and follows the Eagle River all the way down to the Glenwood Canyon. And over the course of those 50 miles, there's about 44,000 full-time residents. However, during peak surge times, like this time of the year during spring break, we'll have actually over 200,000 individuals, tourists and residents in our community at one time. But one thing that's unique about our community, and I think this is a very familiar thing we see in all tourism and resort areas, is that over 30% of our full-time residents of our workforce is actually primary Spanish speaking. And so it does allow for us the opportunity to really focus on how to target those distinct populations. And we'll talk a little bit about that today. Next slide. The COVID timeline. So I think everybody has lived this. I bet it's good to go back and remind ourselves where we've come over the last 14 months. We actually started our work here at Vail Health in January of 2020. We were watching what was going on in Wuhan, China, and realized that with the international travel, the Chinese New Year, that it was just a matter of time with our international base location that we would have the virus here. And as we later found out, it was actually here in late January and early February. We had the International Snowboarding Championships. And beginning in early March, as soon as we were able to do COVID testing, we immediately identified it in our community, and we started the full response. One of the things that became really important for us was to maintain and develop really strong testing infrastructure, because we knew that if we could allow free wide-scale testing for everybody, that those folks would come in and get tested. And then if they had COVID, individuals would take the right precautions to hopefully protect the most vulnerable, the folks that ultimately could end up in our hospital, those that are higher age groups, those with comorbidities, etc. So one thing we pushed really hard to do was get testing in-house. So rather than sending tests off-site either to the state laboratory or large retail national labs, we wanted to bring that infrastructure in-house so we can run the tests rapidly. And in November, we were finally able to do that, and not only do it for our valley, but we were able to do it for the whole mountain region that we support, which is another 5 counties that were sending us tests during that time. We were able to do testing so well that in December, the state reached out to us with 2 opportunities. One was to be the first location in the state of Colorado to actually test the vaccine delivery, because at the beginning of the vaccine delivery, if folks remember, there was a lot of worry that maybe the transportation might be disrupted, and just all eyes on getting those vaccines to where they need to go as safely as quickly. So Vail, Colorado was actually the first place in Colorado to receive the deployment of the vaccine. But at the same time, the state set up a contract with us to be a regional testing site and now a regional vaccination site for the entire state, which is a big recognition that we're very proud of. In summary, we've actually tested over 55,000 individuals for COVID-19, which is hard to believe as our population is only 44,000 folks, as I mentioned. And we've, as of today, administered over 17,000 COVID-19 vaccinations. Here's a little timeline. I don't want to go into all the details of this because I want to make sure we have time to talk about the IT lessons learned and how it's affecting us going forward. But we're just really trying to convey here that we've been doing this game for now 14 months, the entire last year and moving into this year. But you can see these last quarter, if you will, a lot of great things have taken place, a lot of innovations. And that's what the rest of our presentation is really going to be about, is how we've leveraged technology to really optimize our workflow and increase our ROI.